So let's talk about exercise testing in COPD and CRPD. Most of you are familiar with treadmill protocols. Of course, we want protocols that are not super aggressive. Walking treadmill protocols, cycle protocols, the YMCA cycle test. The 6-minute walk test is used a lot in cardiac and pulmonary rehab. So that's the amount of distance that a person can cover in 6 minutes. And it's very convenient because we have the West Center track and we can do that very easily. But even if you don't, you can do it in a hallway, you can do it in a much smaller space. So the key is to have very low increments in the testing. People may need to be tested with supplemental oxygen, have ECG monitoring. They're probably going to have their oxygen saturation monitored. And typically what they do if they suspect somebody has pulmonary diseases, they'll do spirometry testing both before and after the exercise test with the metabolic heart. Clients should always take their usual medications unless the doctor tells them not to. And of course, we're going to be monitoring their blood pressure. We're also going to monitor their perceived exertion. And just like there's an RPE scale, there's a 0 to 4 scale on dyspnea. So the physiological changes that happen with CRPD, so reduced rates of gas exchange, of course, because you're losing surface area for gas, particularly if you're thinking about something like lung cancer. Alveolar units can eventually collapse. Reduced ability to ventilate, especially like if you're thinking of somebody who has a spinal cord injury or somebody who has some sort of, chest rib cage deformity. Increased dead space where no gas exchange takes place. More energy to breathe. Pulmonary hypertension, so high blood pressure in the lungs. And we also talked about poor aerobic fitness. And people are also going to have very rapid but very shallow breaths. Lung cancer is a restrictive lung disease. About 200,000 new cases a year. And we'll go into more detail on this when we do the cancer topic specifically. But it is number 1 in cancer deaths for both men and women. So interestingly, if you go way back to the early slides in this lecture where you look at the, COPD, how the numbers rise with age, but still the number 1 cause of cancer deaths, despite breast cancer getting all the publicity, it is lung cancer. So lung cancer is the number 1 cause. And for a lot of reasons, particularly because oftentimes by the time people have symptoms of lung cancer, it's often found very late. So oftentimes it's found in late stages where there's very little that people can do for it. Whereas with breast cancer, we get early detection. So a lot of women who may get breast cancer are not always going to immediately die from it. There are 2 different types of lung cancer. There is the small cell lung cancer, and that's exactly what it looks like. They also call it like oat grain. It looks sort of like oatmeal. That's what the tumor looks like. That's the smallest number of cases, 15% of lung cancer cases, but it is more aggressive and people don't survive very long at all. The 1-year survival rate isn't even 25%. Most people only live a few months with small cell lung cancer. And so the non-small cell lung cancer, which is everything else, that makes up about 85% of the cases. And if it's caught, in the earlier stages, it's much more survivable and it has a much better 1-year and 5-year survival rate than the small cell. Risk factors, of course, for lung cancer, smoking, we'll talk about that. And it does include secondhand smoke, as I mentioned about Dr. Tony Yancey. So, secondhand smoke is a risk factor. There is no amount of secondhand smoke that is safe. People who work with asbestos. So, particularly, people worked in flooring and plumbing, steel mills. A lot of these guys that are now up there in ages, asbestos was found in many, many products, insulation, vinyl products. So people were exposed to it on their job, and so they developed a very specific type of lung cancer called mesothelioma that is related directly to asbestos. So hopefully we'll be seeing less and less of asbestos-related cancers as people have better on-the-job protection. And then there's another thing called radon gas that might be a little hard to see at the bottom of the screen, radon. So that is a radioactive gas that's in the ground. So that's another non-smoking related cause of lung cancer. This part of the country is not known for a high radon area. Certain other parts of the country, you may, if you're buying or selling your home, you want to have a radon test done. And so what they do is they drill a hole in the foundation of your house and they ventilate that out to the outside, and you can get rid of the radon gas. I actually had that in my previous home in Virginia.